So the abuse screening questions that we ask here at Methodist, it's a series of 3 to 4 questions, and it's all related to the patient's current safety. So we ask the patient if they're currently safe in their home, and that can have a lot of different meanings, but at least if we begin with that question, then it gives us somewhere to start the conversation, and we can go off of that based on their answer. We also ask if they're safe regarding their current relationship and previous relationships, and we assess to see if there's any immediate threat to their safety. And the healthcare providers are trained to ask that in a private environment, just the healthcare provider and the patient, to ensure the patient's safety when we're asking these types of questions as well. So it's very common for patients to be hesitant to come forward about how their injuries occurred if it was the result of a domestic relationship or domestic violence incident. It's very common for patients to be hesitant. So there's a lot of different reasons that patients may be hesitant, and in my opinion, among those many reasons, the common theme is fear. Fear for the own patient's safety, fear that maybe their family and friends will find out that they've been in a violent relationship, and fear of the unknown for their future, because it changes a lot of things in their life. And the fear is very real for these patients, and studies have actually shown that the risk of homicide increases, and it's the most dangerous time after someone leaves a violent relationship. So our healthcare providers are trained in that, again, with the Best Legacy of Hope program. It has a scenario where the patient initially doesn't want to come forward about how the injuries occurred. However, we train the healthcare providers to really demonstrate that they are concerned for this patient's safety. Not to repeatedly question this patient again and again and again and hound them over it, but to ask this question in an appropriate and compassionate manner and let them know that we truly do care about their safety, and we do have resources in place, such as a forensic nurse and such as social work, that's available to help this patient.
If someone doesn't want to be forthcoming about how they got their injuries, at the end of the day, is there anything your staff can do?
No, at the end of the day, if a patient does not want to come forward, we just let them know so that they can make an informed decision. We let them know what resources we have available here at the hospital. We let them know what resources are available in the community. But ultimately, it's the patient's decision. And if they choose that they do not want to come forward about the injuries that occurred from a domestic abuse situation, then that's up to the patient. The only thing I do want to say is that it's completely normal for individuals to be hesitant to not come forward if they are a victim of domestic violence. And if you're struggling with abuse, just know that when you are ready, we are here to help you. We can help you to put a safety plan into place before you leave the situation, or if you have already left the situation and maybe you need assistance with protective orders, housing, transportation, we can assist you with finding those resources as well.